Hello, ma'am. Hello, baby. Okay. Ma'am, I am JR Pon and I will be your child's PT for today, ma'am, ha? So, I will be starting my treatment na, ma'am. Baby, mag-start na ako, baby, ha? So, first, I will be using, just for your information, ma'am, I will be using a frequency-specific microcurrent nga modality. So, this will be used to address a pain nga ma-feel ni baby, ma'am. Okay, baby? Kaya mong kanang kasakit ni mo. Ito na, huwag tanong, baby, ha? Okay. So, I will be starting na, ma'am, ha? So, first, I will be attaching the wet bib. Baby, na lang ko i-add, ha? Oh! Okay. Ha? Okay. Baby, kaya na. So, attached with alligator clips to the modality. Chuk, okay. Then, wait lang, relax na, baby, ha? Ma'am, I will attach na sa kong electrodes, ma'am, ha? Okay, distal to the SEM na insertion. Okay. Relax lang, baby, relax. The wheels on the bus go round and round all through the town. Okay, electrodes are secure. Start na ko, mama. Baby, start na ko, ha? Okay. So, turn on the modality. Switch intensity. Frequency to 50 milliamperes. Then, set to 20 minutes. Relax lang, baby, ha? Relax, relax lang, relax. The wheels on the bus go round and round, round and round, round and round. Oh, baby. While naani, no? While naani atong modality, stretch lang tika, baby, ha? So, ma'am, i-stretch lang nako si baby, ma'am, okay ra? Sige, baby. So, i-stretch tika, ha? Oh, baby, look. Awa. So, look at there, look at there, oh. Oh, okay. So, move tika, baby, ha? Oh, okay. Look dito. Look. Okay. So, i-stretch na ko imuhang lateral nga cervical lateral flexors, ha? Oh, look, baby, look. Sige, relax lang, baby. Okay. Stretch na to for 2 reps and 30 seconds hold it. Look lang, baby, no? Nice, kino? Wow. The wheels on the bus go round and round. Okay. So, while approximating the shoulder, look, baby, no? So, after 30 seconds, rest. Wow, very good, baby, no? Nice kiss, ha? So, oh, look. Okay. Nice kiss, baby. So, balik ta, baby, ha? Okay. So, back the position. Baby. Okay. Okay. Oh, nice. Look, look. Dog. Oh, dog. Arf. Okay. For 30 seconds. Okay. Okay, baby. Relax lang. Oh, arf. Arfon. Okay. Okay. Balik to, baby, ha?
Hello, what we're gonna do today is we're gonna have stretching exercises for our cervical rotators. So for this stretching exercise, we're gonna perform cervical rotation with the patient's trunk against the therapist's trunk, and the patient will look to the left side to stretch the cervical rotators.
So the patient will
so
go to the
here,
side.
this exercises will be performed with the modalities attached to the patient. So assuming the modalities are attached to the patient, okay? So these stretching exercises will be done for 2 repetitions, and we would start with 30 seconds hold, then progress to 30 to 120 seconds hold, or as tolerated by the patient. Okay? So hello, Tio.
Hi.
I'm Berna, your physical therapist for today. So today, what we're gonna do, kaya I have your favorite toy here. This is your favorite, right? Okay. Then what I want you to do is I want you to follow the toy. It's like that. Okay. Okay, we're gonna start, okay? 1, 2, 3. Follow the toy. Sige, now tell me, what do you see, man?
It's green and white and black and also white here and red.
Okay, very good. Okay, so now you tell me, do you know any kinds of dinosaur, baby?
Yeah, there's
The other way to stretch the cervical rotators is by letting the patient be positioned in prone on the therapist's lap, and then have a toy, then let the patient look to the left side. What is this? What is this, Tio?
this is a big dinosaur.
What do you see?
Never
What else do you see, man?
This
What's
is
the color? You tell me the color.
this brown and black.
And then
And
this, now we're gonna stretch the cervical extensors. So here we have the patient in supported spine position, and the patient will approximate the head towards the pelvis. Leo, now I have this dinosaur again, your big dinosaur. Then I want you to reach for the dinosaur and lift your head, okay? Like that. Okay, very good. Okay. 1, 2, 3, lift lang. Lift. Okay, down. Again, we're gonna do it again, huh? Okay, 1, 2, 3, lift the head, lift the head, lift the head. Okay, down. Okay, again. Lifting head, kuya, lifting head. Okay. To eat you na. Okay, last one. Okay, 1, 2, 3, lift. Oh.
Strengthening exercises and postural re-education exercises, specifically tipping or swinging to the left and backward tipping. So, hi mommy, so I am Marie Lourdes Villartado and I'm a physical therapist for today, the physical therapist of your kid. So, hi Dong, hi kid, hi. So, today we're going to do some exercises, strengthening exercises to help with the current condition of your kid, and I encourage you to watch me do the procedures, do these exercises, as this will be very helpful for you when you get home and when performing these exercises by your own with your kid. Okay, now, and I assure you that anything that happens here stays here, and information that will be exchanged between us stays here. Okay, so pwede mo play? Okay, so, hi baby, hi. So my name is Ate Lou. Yes, Ate Lou. So pwede ko namin call Ate. Oh, Ate. L-A-T-E. Ate. So, mag-play karon ha, mag-play tag taman karon. Oh, dagan kay toys. Na si tiger. Wow. And na si cow. Wow. Then, na si duck. Hala, masing si duck. Masing awa. Oh, yan kay pasing. Sige, ikaw daw pasing duck. Oh, I press ni kay pasing. Ising si duck. Sige, ikaw daw ipasing ang duck. Wow. Ising pa ganahan ka ni duck. Oh, sige, mag-play tataman together with ni duck. Mag-play tataman kita upat, imong mami, si duck, ako. Ay kuyog sa ni si cow and si tiger. Ana na sila magwala sila nato ganahan jud ka ni duck. So, play balik ni duck, okay? Wow. Masing nanuon si duck, sige. So, ato na ito papasing si duck, no? Sa inyo kayo, immersion, i-press. So this could be a great opportunity to have the kid be in a tipping or swinging position, considering the head righting reaction, optical righting reaction, in which if the patient is tilted to, or the patient's posture is deviated, the patient would align his or her head midline. So since the direction of tipping or swinging is to the left, so that I could have this duck, since this is the object of interest for the patient, to the right, so that the patient would try to reach it using his right hand, so that the weak right sternocleidomastoid would be activated. So in that manner, there would be strengthening of the weak sternocleidomastoid. So when the patient is tilted to the right, the patient would try to, as much as possible, reach for the toy to press it to make it sing, and that would be help with aligning his head in the midline, so that he would be able to achieve his goal, which is to make the toy sing. Okay, so sige, mag-play na ta. So, dapat ipasing mo kadaghan ang duck. Ipasing kadaghan ha, pasing. So, pasing kadaghan, sige. Ipasing daw, pasing. Pasing. Wow, balik. Pasing. Wow. Pasing. Kaya mo sing ang duck. Wow, very good. Missing. Let's go, balik. Last. Missing. Good. So this could be done 5 repetitions, at least 5 repetitions. Could progress depending within the patient's tolerance, considering that this is a kid. So mag-play na sa taglain. Oh, naalagi si Doc. Narapin mo si Doc. Diri original pin si Doc, ha? Nursing sa diri mag-play. And so, mami, kanang, I want you to hold your kid. Hold lang siya, standing position lang. So much better if you situate yourself like this, your kid in between your knees, since the knees would act as stabilizer to the kid. Specifically, that would be tilting your kid a little backwards as part of the exercise. But make sure that you don't depend much on your knees. You also should stabilize your kid using both your hands below your kid's armpits like this. So make sure to tilt your kids a little backward. So this is a great way another good opportunity for the kid to try to reach forward with the head in midline from a backward tipped position with the object of interest in front. Make sure it is eye level of the patient and in midline, so that when the kid would try to reach it, he would try to as much as possible align his head in the midline in order to achieve his goal, which is to make the duck sing. So like this. So there will be activation of the sternocleidomastoid muscle both sides. So sige mami, kanang i-hold ni siya ha. Sige. So play na ta, mag-start na ta. Kita tulo ni mami. Okay, sila ka, mag-play sila nila, mag-watch sila na to. Mag-watch sila, mag-perform, musing. Si Doc, so dapat ipasing ni mo ha. Yeah. Musing sa tagapil. Kaya para maganahan musing si Doc. Sige daw. Ano daw si Kao na? I-reach daw. Ipasing daw si Doc. Pasok daw pasing si Doc. Pasok daw pasing si Doc. Wow. Ganahan si Agner. Yay. Ipasing daw ba si Doc? Mag-concert na si Doc. Mag-concert siya balik. Ipasing daw. Pasok daw pasing si Doc. So ganito. Ikaw daw. Wow. Pasad sing. Wow. So pasing daw. Pasing. Saan daw pasing si Doc? Very good. Sila. Ganito sila. Ganito na si Doc. Wow. Stop si Doc. Wow. Very good. Very good. Okay, so again, like the tipping or swinging to the left, this could be done at least 5 repetitions, progressing within the patient's tolerance, considering it is a kid again. So that
In way para ma-strengthen o ma-correct ang posture ni baby. So maglingkod gani siya sa imuhang lap, imong buhaton may posisyon imong kamot sa ubos sa iyang hilok. So kung mahiwi gani siya on one side, pwede nimo siyang ipabalik og tarong lingkod. Gamiton imong kamot para mag-guide si baby sa unsay sakto na posisyon. Maka-strengthen na ni siya sa iyang right side sa iyang lawas, plus matanong pag yung posture. Yeah. Pwede po nimo siya buhaton na imong hiyagwa ang bata na mag-atubang mo. Yeah. Kung mahiwi na po siya on one side, imo na po siya itarong. Basta diha lang ka sa ubos sa ilok, gunit ma'am ha. Ayaw sa shoulder. Yeah. Ayaw lang po sa may hips, gunit ma'am ha. Diha gyud ubos sa may ilok gyud. Karon kay naman tay toy ron ma'am, atong buhaton himo na kunuhay tay ball. Imagine ball na siya, imo position si baby sa kanan. Ball na diyan toy niya. Siyempre na-distract ang baby. Karon i-position si baby na maghapa siya sa ball. So ighapa ni baby sa ball kay mura siya og kanang siyempre managanaw sa siya, mahadlok siya. Pero kadugayan kay muhapa gyud na siya kiyaha. Muhapa ma'am no, muhapa siya. Mura nagnakuan na iyahang shoulder kay ni work yung shoulder pero ni depress ang iyang scapula or marag ninaog yung scapula. Yeah. Expected na si baby iya gid nang kuan kanang mura bag mohangad siya kay para makita ang toy. Ya ikaw imuhang kamot i-position sa iyang hips murag para madili matumba si baby og kuan dili siya matumba na mura siya wheelbarrow ma'am no.
For right upper extremity reaching, in combination of full body extension, flexion, and rotation, we introduce a stimulus in form of a toy. Since the patient is 19 months old, we place the patient in a supine position. We introduce a stimulus, we place it in front of him, dangling it in front. So he will look at it and then try to reach for it. So with his right hand, he will reach. So there will be elbow extension and shoulder flexion. So if we want trunk rotation, we will place it a little to the side, so he will try to turn his body. So there is rotation and still shoulder flexion and extension. So that is for right upper extremity reaching.
So hello ma'am, we will be starting our gentle massage, okay? So this is to release the tightness sa muscles ni baby sa iyang neck area and also to allow freer motion sa iyang neck, okay? So mag-start na ta. So duwato na to si baby, okay? Hello baby, mag-start na ta, okay? So first what we'll be going to do is to position baby sa iyang tummy or sa iyang stomach, maka-lie down siya. And placing the baby's favorite toy, which is si Groot. So atong i-place sa iyang left para ma-direct na to iyang head towards the left. Okay. So first is we will be getting oil and putting it on our hands and rub it together para ma-warm up sa dang oil. So with this, kay mag-start na ta, okay ma'am? So first is a longitudinal or cross friction massage. So with this, we will be focusing on the upper trapezius nga muscles ni baby sa iyang SEM, left SEM, and also to his scalene nga muscles, okay? So with this, we will be using both thumbs in order to do the massage. So first is we will be going to be following the fiber of the muscles and also to cross over the muscle fiber ni baby, okay? So one thumb over the other. So following the muscle fiber here. And next we will be going to cross over the muscle fiber ni baby, okay? So here in the clinics, we will be doing this for 3 minutes each. Okay, so now assuming 3 minutes is done, so we will now proceed to our next massage, which is the trigger point release massage. So with this, okay, we will be using 2 fingers in order to palpate the muscle or to touch over the muscle and gently applying small pressure, okay? So take note lang ma'am nga we should always use gentle lang a pressure, okay? Para sa dili sad maka-feel pain si baby. So with this, with 2 fingers, touching over the muscle and applying gentle nga pressure. So with this, we can release the tightness of the muscles. So over siyang upper traps here, siyang scalenes, and siyang left SEM. Okay, so assuming that 3 minutes is done, so that concludes our gentle massage here. So again, ma'am, you can do this at home for 5 minutes. So I'll take baby na. So hello baby. Okay, tano. So that concludes our massage therapy. So we will now proceed to the next one, okay?
Now, ma'am, I will be teaching you exercises that you should do at home so that makahelp sa baby, ma-better na ang baby. So first, I want you to bring the baby towards your left hip. So there, and then the baby will tilt the head towards the right. Tilt yung head towards the right. And then, and it will tip to the left. So yes, that's right. So you should do, you can also do it in standing, ma'am. Okay, so tilt the head to the right. Okay, very good. So, ikaw daw, ma'am. Back daw ang baby. Saan mo siya pag-position. Saan mo pag-position ang baby. And then, tilt. And then,
Tilt to the right.
okay. Now, I will teach you another exercise. So, we will need a pillow. So, at the back of the baby, so that ang baby kayo ma-position siya slantly. So, paslant ang baby. So, now, first, ingunin mo si baby, ma'am, na look towards the tanaw sa ubos or look down. So, look down with your head. So, apil lang ang head. So, kadang ubos. And then, ingon sa mo siya na tanaw sa twist your head kadong sa left. Yes, twist your head sa left. So, yan na. Yan na yahang movement. So, ikaw daw, mamiingnan daw yung baby.
Be tanaw sa boss and then move your head to the left.
Okay. So, yan na ako sa balay. Thank you. So, ito yung buhatan sa balay mo, ha? And kato ko ito sa mo ganin na mga itong himuon para makusga ng mga muscles sa neck sa baby. So, another way sa dato, ma'am. Ito na siya, baby. Ito siya ipangkod. Kay imo ang lingaw ng baby na. Baby, tanaw niya siya.
Baby.
So, tanaw siya sa ubos. And then, padung sa right. So, yan ang sundon ang toy. So, other way sa datong usa, ma'am. Pwede sad. Ito.
Lingawan sa
pagkataon diri. Ang ulo kay mo. Tilt, padung sa lingaw man siya. So, mangingawon sa toys para iyang sundon sa iyang ulo. Kung asa.
So, assuming that I'm talking to the mother of the patient, so, hi mommy, there are other exercises that baby can perform sa inyong house, like positioning exercises, such as playtime in prone position, playtime in sitting and standing position, car seat position, and sleeping positions. So, these positioning exercises can help promote turning of the head ni baby sa iyang left side, full active cervical rotation, and as well as lateral flexion or side bending. First is the playtime in prone lying position. So, mommy, ang buhaton lang ni baby here is just let him lie on his belly sa flat surface, and if makaya man gani kayo, you can progress to kanang wedge nga surface. And then, just get baby's favorite toy and place it on his left side. So, if wala gani dira ang attention ni baby, kay you can place his favorite toy in front of him, and then slowly bring it siyang left side to direct his head to the left side. So that's basically it. Next is the playtime and sitting position. So what you do here, mommy, is basically the same lang sa prone lying position. So get baby's favorite toy again and place it siyang left side. But make sure nga ang toy is eye level lang ni baby to direct his head jud sa left side. The same thing, if wala ang attention ni baby sa toy, you can place the toy in front of him and then slowly place it to the left side. Also, while doing that, you can stabilize or hold baby's shoulders to make sure that when baby turns his head to the left side, the body doesn't turn as well.
So the next positional or postural exercise that I'll be teaching you is the car seat position. This is very important when you want to travel with your child. So you don't want to compromise the posture when you travel long periods of time. So since your child has already a left torticollis, the tendency is like this. The head is tilted towards the left side and rotated towards your right, and prolonged travel time will create an extensive effect or on these positions. So we want to avoid that. So what you need to do is to place a firmly rolled thin blanket or towel beside the head in both sides of the head and the body to keep the head in midline position. Okay, so we need to counteract this motion of the child. Okay, so roll a blanket. Okay, so example, these are two rolls. So ibutang nimo siya sa side. So you can see a very noticeable difference, right? So without the blanket or the towel, the head is tilted towards the left, but with the addition of the blanket, the head is directed towards the midline without any tilting or rotation, unlike before. So we want to keep this proper posture when traveling or positioning the child in a car seat. The exercise that I'll be teaching you is your sleeping position. So since the child will be sleeping for long periods of time, it is ideal to incorporate some therapeutic activities or exercises within that time period. Okay? So since your child has a left-sided torticollis, so the head is tilted towards the left and rotated towards the right, so like this. Okay? So what you need to do is to stretch this side. So while sleeping, you need to position your child in a side-lying position on the left side. So like this. So you can see from this position, like this, if imusing ipalay down, must stretch siya. Okay? Must stretch. You can also put a pillow or like a blanket here. Wait. Okay. So like this. Now. So you can see that the neck is stretched in this side.
And then, para dili na ka mag-hold niya for the entire time nga nag-sleep siya, you can add a rolled blanket sa back niya. And pwede sa ka mag-add o blanket front. So, para ma-stabilize niya nga position while nag-sleep siya.
Ma'am, maghatag ko nimong instructions para sa inyong home instructions para ikaw ni mubuhat sa inyong balay or kinsa may mubantay sa bata mao sa imo mubuhat ani. So kani ang sud ani is ang summary sa tanan natong gitudlo nimo during the session, and mo ni siya ang imong sundon or ganahan ka mo basa diri sa mga positioning ug stretching ug strengthening sa bata. And magbuhat ang strengthening mo no para after sa imong stretching session. And please lang ma'am, musunod ta ni ma'am no para musunod ta ning activities na to, plano na to para sa bata lang. And frequency lang ani is 4 times a day sa stretching, 4 times a day with siguro 10 seconds or 15 seconds kada position, and kaduhaon na itong balik. So 2 times ang repetitions. So after ni mag-review ta sa gitulo na po nimo nga stretching, strengthening, and positioning sa baby. So sa patra ma'am. Okay, wala ni ma'am no? So karon ma'am, ni-mention mo po og home instructions. Ato lang i-review or mga tanan lang ko nimo if nakahinumdum ba ka sa gipang tudlo during the session. Okay ma'am? So based sa positioning sa bata, nakahinumdum ka ato ma'am no? So katong iyang playtime na position, ang katong kog o maghayang, nahimdum ka to no. And positioning sa bata, asa ka mag-handle, binigkari ni mo niya, nahimdum ka, katong ibutang sa imong left hip, nahimdum na no. Okay, so katong wheelbarrow nga position pod, katong iyang tilting, kinumdum ra pud ka to ma'am no, mo tay buhaton na to sa balay. And since naamsad mo yung sakyanan, katong car sitting position o katong iya pagtug nga position, kinamdum ra kadto mo no. So mo to siya, and apilan nimo to og cervical katong mga head positions sa bata, stretching sa bata pa forward, pahangad, pa side to side no kadto. Kinumdum man kadto kay gituluan mo sa kana mo antong sessions. So buhaton lang ni nimo no 3 to 4 times a day as mentioned, with 10 to 15 seconds kada position ma'am, and kaduhaon mo siya, kaduhaon 2 times kada repetitions din. Okay, sabot ra ma'am. Okay, thank you. That would be all.
Today, I will be explaining to you precautions to consider and take note for us not to harm your child and further complicate his condition as you go into your home. First, not only in the rehab that utmost care is facilitated during the treatment, but also with the home exercise program prescribed to your child and any other activities you do at home. Second, we have to observe proper body mechanics at all times during the exercise so that we can avoid the risk of further complications such as falls. Third, we have to stop the exercise when the patient cries, or we can rest for a while, and not to exercise when the patient feels unwell, and then report. If the patient is unwell, you have to report it to the physician or to us PTs. We must work gently within the patient's tolerance, meaning we have to go only to the extent where the patient has the capacity to endure the exercises. We have to take consideration his age and needs, especially that he is still young and given his condition. Lastly, in prescribing the home exercise program you have for your child, you also consider the needs of your child, your family, and the resources within your means. So we have also included these precautions in the paper together with the home exercise program.